All right, and we can get started. Hi, everyone. My name is Jen Frisch, and I'm on here with my teammate from LEAD, Christy Van Sand, and the fabulous Susan G. Komen staff. Thanks so much for joining us today for what will be an enlightening presentation on Susan G. Komen and how you can get involved in your own breast care and the work to end breast cancer forever. You will also learn today about our very own B of A Women's Lead Race Team and how you can get involved in this year's Race for the Cure. We want to say a big thank you as well from Bank of America and our staff to Susan G. Komen for their partnership over the years. It's just been fabulous, and we're extremely grateful for this. So now we have a short video that we want to show before getting into the presentation. Thanks again for joining.
Good afternoon, everyone. My name is Erica Bowles, and I am the Development Director for Susan G. Komen in the Carolinas. And I'd love to just thank Jen and Christy for organizing today's webinar. We hope you find it to be informative, and if you have questions, you can feel free to add those to the chat box, and we will answer those, if appropriate, throughout the presentation, but at the end as well. So the mission of Susan G. Komen is to save lives by meeting the most critical needs in our communities and investing in breakthrough research to prevent and cure breast cancer. We achieve this mission by focusing on two things. One, finding breakthroughs for the most aggressive and deadly breast cancers. And two, ensuring that all people have the care that they need. In order to do this, we also focus on 4 pillars. Komen has a 360-degree approach at ending breast cancer, and you'll see here we list our 4 pillars of our work: research, care, community, and action. Innovative breakthrough research, leveraging technology, and big data to accelerate discoveries are how we're finding cures and saving lives with our research. Direct patient support is how we're providing care in a transformative patient engagement and care experience. We are able to then drive outcomes for every patient, no matter where they live in the United States. And we do that through our Komen Helpline, our Patient Treatment Assistance Program, our Patient Navigation Program, and through our educational resources at komen.org. Our community aspect is part of what Bank of America's team is doing by participating in our Race for the Cure and our other events throughout the country. We're able to provide a sense of support and community as a safe place where people can find the strength to move forward. And lastly, advocacy. We work on a national, state, and local level to inform government action to make broad, systemic, and lasting changes that we need to ensure wide-ranging patient rights to save breast cancer patients and to continue investments in our research. Now, Komen believes in advancing health equity, and in doing that, we think that where you live and what you look like should not determine whether or not you live. Yet, when it comes to breast cancer, underrepresented communities are underserved at almost every step of the healthcare system, including before they're even diagnosed. That's why Komen's working to achieve health equity for marginalized communities who die of breast cancer at disproportionate rates. Health equity means that everyone has a fair and just opportunity to be just as healthy as possible. Unfortunately, in the United States, this is just not the case. For example, we know that Black women in the US are 40% more likely to die of breast cancer than their white counterparts. And that's simply unacceptable. Komen understands that to achieve health equity, obstacles to better health outcomes just have to be removed, which is why Komen's working every day to remove the barriers of care for marginalized individuals and communities so that all people have access to the programs, to the services, and the support for their breast health. We're also funding research to understand the roots of these disparities and advocating and supporting legislation that result in systemic change. The intentional focus reduces health disparities and ultimately will save lives. So let's talk a little bit about breast cancer rates in the United States. Did you know that mortality rates have decreased by 40% since 1989? That's because there has been a greater focus on the increased access to early detection and more effective treatments. However, this progress is in jeopardy without the support of the breast cancer community to help those that are facing the disease today. And unfortunately, we expect the results of the COVID-19 pandemic to have a significant impact on overall cancer deaths in the coming years as people are delaying their screenings and delaying their treatments. So here on this chart, you'll see that breast cancer is the leading cancer diagnosed in women, followed by lung and uterine cancer. This year alone, 281,000 women are expected to be diagnosed with breast cancer, and 43,000 of them will lose their lives to this disease. But breast cancer isn't just something that affects women. About 1% of all cases of breast cancer are found in men, which is why it is important for everyone to know the symptoms and signs of breast cancer. So we want to talk to you a little bit today about some of the most common risk factors, but also how you can be aware. Now, our two most common risk factors for breast cancer are 1, being female, and 2, getting older. We can't control those things, obviously, but there are things that we can do that play an important role in your breast care. So we have 4 self-breast awarenesses that we think are important for you. 1, know your risk. 2, get screened. 3, know what is normal for you. 4, lead a healthy lifestyle. So over the next few slides, I'm going to go over how each of these messages are important. So let's start with knowing your risk. First, we think it's important for you to talk to your family about your family's health history. This kind of information can help you learn about your risk of breast cancer, who has had breast cancer or other health problems or other cancers in your family. Komen actually has a helpful tool on our website that can help you to gather these pieces of information and know what questions to ask. Second, talk to your doctor about your personal risks of breast cancer. Bring your family history with you and then discuss the appropriate time to start and how often to have breast screenings. Which brings us to step 2. When you talk to your doctor and understand your risk, it's important to talk about getting screened. If you're at a higher risk, talk with your healthcare provider about which screening tests are right for you and when they should begin. If you're at an average risk, it's important to have a clinical breast exam at least every 3 years, starting at age 20, and starting at age 40, you're going to want to do that every year. It's also important that women at an average risk have a mammogram every year, starting at age 40. Now, Komen has another great feature for you on our website. It has a screening reminder tool that can help make sure that you never miss one of your screenings. So you can go there to komen.org/reminder and get signed up for that. So now we know what we got to do is the first 2 steps. Step 3 is knowing what's normal for you. It's important not only that you know how your breasts look, but also how they feel. That way you can report any changes that you might see or feel to your healthcare provider. And then this applies to you too. So in the next slides, I'm going to give you a few examples of what to look out for. The warning signs of breast cancer are not the same for all people, but society as a whole has done a really good job of informing people to follow up with their providers if they find a lump in their breast. But visual changes can also be a first sign of something that's going on in the breast and should be checked. Here are a few of the warning signs to look out for and definitely to report to your doctor if you notice them. Lumps and hard knots or thickening inside the breast or underarm, swelling, warmth, redness, or darkening of the breast, change in the size or shape of your breast, dimpling or puckering of the skin. Now, you'll notice on these slides that 6 of the 8 warning signs that you see are something visual versus something that you would feel. So some other changes would be itchy, scaly, sore, or rash on the nipple, pulling in of the nipple or other parts of the breast, nipple discharge that starts suddenly, or any new pain in one spot that doesn't go away. So the final key piece of breast self-awareness is to make healthy lifestyle choices. So, you know your history and you've talked to your doctor and you know what your breasts are like, but there's something else you can do, and that is making sure that the choices you're making help you to lower your breast cancer risk. So maintaining a healthy weight, adding exercise into your routine. If you drink alcohol, limiting that to a drink a day for women or fewer than 2 drinks a day for men. Limiting post-menopausal hormone use, which is linked to an increased risk of developing breast cancer. And breastfeed if you can. Women who breastfeed have a lower risk of breast cancer, especially before menopause, than women who don't breastfeed. These healthy lifestyle choices can help reduce your risk of breast cancer, but it's important to note that cancer trends can be caused by a combination of these factors. Some things we may be able to control, like exercise, but some things that we can't, like our age. So there are also still some things that are unknown. Now that you know a little bit more about how to take action and improve your own breast health, let's talk about how Komen's providing support for patients right now through our breast care services. So the Komen Breast Helpline is a free resource that's available to every person, including survivors, caregivers, those living with metastatic breast cancer, and people who have not yet been touched by breast cancer, but maybe have questions about how to better care for themselves. Our breast health specialists provide an assessment for each caller to identify their primary needs and get them access to the resources that will best help them on their breast health journey. They'll also provide emotional support, which is something that can make all the difference for people who need it. Our breast health line also provides a breast cancer clinical trial information and resources if that's of interest to you. And lastly, the helpline is available by phone, by email, and soon Komen's going to be adding a chat function to that. Our treatment assistance program is also available right now to help our lower income breast cancer patients with financial support. Komen believes that no one should have to choose between paying for their breast treatment or putting food on the table. So the treatment assistance program provides financial support for basic needs like housing, utilities, transportation, medication, childcare, food, and much more. Now, our Komen website will lead you to all of that, as well as a plethora of information about educational resources. You can find and access all of the programs that we just talked about and much, much more, including a list of questions to ask your doctor, the family health history tool we talked about earlier, and evidence-based information about breast cancer. Another way to get involved, though, with Susan G. Komen is to participate in one of our races. We have walks and races all over the country, anywhere from 1 mile to 60 miles. And this brings breast cancer communities together to provide support and raise funds. The walks and races are some of Komen's largest fundraisers, which help Komen fund the incredible patient-centered research and community health projects that we talked about today. So I'm going to throw things over to one of your team captains, Christy, to tell you a little bit more about what your team is doing before we hear more about the race. Over to you, Christy.
Great, thank you so much, Erica. That was some fabulous information. My name is Christy Van Sand, and I am part of the Lead for Women Council, as well as one of the co-captains for our Lead for Women team for Race for the Cure this year. This is going to be Susan G. Komen's 25th annual Race for the Cure coming up on Saturday, October 2nd. And like many years in the past, we have a Race for the Cure team for Charlotte Lead for Women. So we'll be sharing information about how to enroll in that. You obviously were able to identify and join in on this session today. In that communication, we did provide a link for how to join that team, but don't worry, we'll be sending out another communication in the coming weeks with that link again. Bank of America has been one of the presenting sponsors for Race for the Cure for many years in a row, which is amazing because it gives us an opportunity to participate at a discount as well. So when you sign up for any of the Bank of America teams, there's also a discount code that you can apply to get a reduced reduced rate on the entry fee. So we'll talk more about that a little bit at the end, but I'd like to go ahead and turn it over to Kelly right now to give us a little bit more information about what Race for the Cure looks like in Charlotte this year.
Thank you so much, Christy. I always love working with her. This is my second year on Bank of America. We're so thankful for your support. We're thankful for your race team. And one thing you might not know that is the Bank of America Elite Women's team is actually one of our top teams every year. So you definitely want to join and be a part of that. So it's exciting. We have a fun week planned coming up before our race on Saturday, October 2nd. So we are rolling out a new plan, and it's our Power of One week. So even though we're not all joining together in Uptown this year, we still want to incorporate so many ways that we can have the power of one and embrace our community during the week with hybrid events and activities to keep us engaged. So we're going to kick off our week that Monday, where you can join us online on our Facebook group, and you'll get to hear from different people that are on the front line of our mission. So some of the things Erica talked about with our patient navigator and our TAP program, you can hear from the people who are working directly with our community and find out everything you need to know. We're incorporating a My One Tuesday, where you can visit the digital My One wall to share your why. To you, race in honor or memory of a loved one, here's your chance to show your photos and stories and messages of hope. We're really excited for Wednesday. We all know we love to be in the kitchen with our family and friends. So we're having a One Community Wednesday where we'll have a virtual cooking class where you're able to make a post-race snack for all of your participants that will be joining you. On Thursday, we're having Celebrate One Thursday. And so we are reaching out to different fitness centers throughout the community of Charlotte to offer classes at discounts or virtual or donation-based, where you can get out together with your family and friends and sweat your way as we get to our race day on Saturday. And then on Friday will be our One Fun Day Friday. And that's where we want you to get outside and chalk your walk. We want you to use sidewalk chalk, get out there, let people know, get them excited to know that you are racing. And then we also will be having our 25th anniversary Flashback Friday slideshow that will be available on our Facebook group. So next steps. So as Christy mentioned, you all already have your team, Elite Women, that's already been created with Christy and Jen as your team captains. So if you have not registered yet, that's what we want you to do next. We want you to register, and we will give you those ways. I know Christy just said she'll put it in your communication where you can register and join the team. The next step would be to personalize your page. So share your story. Why do you support Susan G. Komen? Customize your page with all the details that'll get people excited and want to support you for Race for the Cure. You can set a personal goal. This can be any number that you want. It could be a significant number. Maybe it's a year of survivorship. Maybe it's your age. You can set it at whatever you want. And the fun thing about it is that you can always increase it as you hit your goal. We want you to invite your network. You know, sometimes people don't give because they're not asked to. So we want you to invite everyone. Invite your friends, send your link out. You're able to just send your link out to your friends, email it to them. One thing I love is putting in your email signature at work where people can click, just one click, and get to your fundraising page. One of our easiest and best practices is linking to Facebook. Link your fundraising page to Facebook. You can invite everyone, invite people that you haven't even interacted with. We were on a call last week and we helped a participant set up their page. And while we were on that call, within 10 minutes, she hit her goal and had to increase it. Lastly, download the app. This will let you track your individual or team fundraising. And even on race day, you will be able to count your steps through our app. And so one thing, let me just throw this last part in here that we're incorporating is that we are doing for race day pink pathways. So like I mentioned, yes, we will not be able to join as 15,000 people in Uptown, but we are rolling out a new plan with our pink pathways and we are super excited. These will all be community-based where team captains will volunteer to lead a pathway. So that could be at a corporation, it could be in a park, it could be in a church. And so we'll roll out all of those pink path locations in our communications and our Facebook group, and you will be able to show up that day and the team captain will be there with goodies and balloons and signs as we join each other with the power of one on race day. So as I wrap up today, I'll give you a second. If you have any questions, please throw them in the chat, and I'm going to invite Christy and Jen to come back for any last words or things you would like to share with the group. But thank you again. Me and Erica are so glad that we could meet with you all today. If you have any questions, Erica and I are both here to answer any questions you may have today and even after we're done. So let us know. Thank you so much for your time. Christy, Jen.
Thanks so much, Kelly and Erica, for joining us and giving us the overview on the breast health. I think it was a lot of great information, and I know I'm really excited about what's to come for October 2nd for our 25th annual Race for the Cure. I'll just remind everyone that the link to sign up for the lead team was in the communication that you would have received to enroll for this session, but we will be sending out a follow-up communication as well with that information. Remember to use your Bank of America discount code so that you can get the discounted registration fee. And like Kelly said, because it's a hybrid event and it's virtual, you can extend it to broader members, friends, or family. Definitely a great opportunity to get people involved. And of course, don't forget about the Bank of America donation matching program as well. So that's another great perk to keep in mind. With that, is there any questions or anything from anybody on the phone that we can either answer about any of the materials that Erica covered or anything about upcoming Race for the Cure in October? If you do have any, either come off mute or just put your questions into the chat. All right, Erica, Kelly, I don't think we have any questions. Is there anything else that we need to let our participants know before we wrap up for today?
I think that's it for today. We appreciate you all organizing today's Lunch and Learn. We hope those of you in attendance found this to be helpful, and those of you that watch afterwards. Oh, it does look like there is actually a question in the Q&A. So we spoke too soon. Jean asks, do you have to set up a personal page in addition to the lead page? So to answer that question, when you register, every single person who registers, whether on a team or as an individual, you will get your own personal page created. So what that means is that there will be a lead page where people can make donations to the team as a whole, and then you'll have your personal page where people can make donations to you specifically. So, you know, your grandmother probably wants to make a donation to you and not to lead, but your colleague doesn't want to make a donation to every member of the team, so they'll make a donation onto the team page. I hope that makes sense. And it looks like we have another question here. Oh, nope, just a thank you from Jean, no problem. So, perfect. All right, well, thank you guys so much for having us today. And if you have questions after this, or if you are tuning in later, you can reach out to myself and to Kelly. And we'll make sure that Christy and Jen include that in follow-up information to everyone, how you can contact us.
Great. Thank you, Erica. Thank you, Kelly. And thank you guys for joining or for watching after the fact.
Thank you, everyone.